Have you ever had stomach pains where it hurts so bad that it feels like somebody is stabbing you over and over? Or you might have seen one of those commercials where somebody's running to the bathroom with the uncontrollable urge to go number two? Well, according to the Crohn's and Colitis website, approximately 780,000 people in the United States are affected by Crohn's disease. Men and women equally are usually diagnosed between the ages of 15 and 35. I myself was diagnosed in my early 20s. I thought my life was over, but I learned to deal and cope with it as best as I can possible. The exact cause is unknown, but is believed to be a combination of genetics, your immune system, and the environment around you. Just a friendly reminder that if you have Crohn's, to be extra careful. Why? Because you're immunodeficient, and that's not good with the coronavirus going around. Your chances of catching it are actually higher than that of somebody without. So what is Crohn's disease? Believed to be an overreaction of the immune system, Crohn's disease is a chronic inflammatory bowel disease, or IBD. It is characterized as an inflammation of the gastrointestinal tract, your GI. Gastrointestinal diseases such as Crohn's, ulcerative colitis, and diverticulitis often affect these areas of your GI. So here's your GI. So it affects from your mouth all the way down to your anus. But for the most part, it affects your small intestines and your large intestines, which is also known as your colon. They can ultimately lead to things like fistulas and hemorrhoids on the outside of your body too, or the be-all, end-all, where they cut out your anus and you have to wear a colonoscopy bag for the rest of your life. No, thank you. A little known fact, it might also affect your eyes, your skin, and even your joints. Contrary to popular belief, Crohn's is not actually caused by what you eat. You should, however, keep track of what you eat and how it affects your body. Some foods could cause flare-ups. I myself have to stay away from dairy and citruses. Crohn's disease has no cure. Because there is no cure and it's chronic, ongoing treatment is required. Medications like Humira, Stelara, and Remicade are just a few used to treat such symptoms. I myself get Remicade infusions once every 6 weeks. Just got one today. A nurse will come to my house and administer it through an IV for a couple of hours, always checking my heart rate and blood pressure, even my temperature and weight. They also have infusion centers like Denton Buffalo if at-home therapy is unavailable. I know this brings up the question everybody's been dying to ask. Is it contagious? Well, you all can have a sigh of relief as it's not like COVID-19. If you're experiencing symptoms such as frequent diarrhea, rectal bleeding, unexplained weight loss, fevers, abdominal pains and cramping, fatigue, or reduced appetite, you might want to set up an appointment with your local gastroenterological doctor and get that checked out. Procedures like colonoscopies, endoscopies, and blood tests are done yearly. Scopies are when they insert a camera on the end of a tether, either down your throat or up your anus. Then they use the camera to take pictures of your GI tract. They also have advanced procedures like a camera pill. First, they hook you up with a whole bunch of electrodes. Those are all connected to a box that you have to wear a minimum of 8 hours. Then you swallow a clear pill that has a tiny camera inside of it. And as it goes through your GI tract, it sends tens of thousands of pictures to the box. Pretty neat, right? So that brings me to my conclusion. Why am I telling you all this? Don't always judge a book by its cover. Millions of people suffer from chronic diseases all over the world, and you might not be able to tell. Be kind. You or someone you love might be affected by one of these.